So if you live in Taiwan, you're part of something pretty huge, the National Health Insurance, or NHI. But what does that actually mean for you day to day? Well, today we're going to pull back the curtain and demystify the whole thing so you know exactly how to use it. You've definitely got one of these cards, right? It probably just sits in your wallet. But that little piece of plastic, it's basically your key to one of the best healthcare systems in the world. So how does it all work? Let's dive in and find out.
All right, here's our game plan. We'll start with the big idea, what I like to call the giant health piggy bank. Then we'll figure out who has to join, how you fit in, how we all pay for it, what you get out of it, and finally, how the whole system stays healthy.
First things first, the giant health piggy bank. Honestly, this is the easiest way to wrap your head around what the NHI is all about.
Okay, so right out of the gate, the law calls the NHI a compulsory social insurance. Now, that word compulsory is everything. It means this isn't optional. You can't opt out. It's a giant safety net where we all contribute. So if you get sick, injured, or have a baby, the money is there to help. No one has to go it alone.
And this is that piggy bank idea in action. It's so simple. You put in a little, your boss puts in some, and the government puts in a bit too. All that money goes into one massive pot, so that whenever anyone needs to pay a medical bill, the fund is there to cover it.
So we have this massive collective piggy bank. The next question is pretty obvious, right? Who exactly has to put money in? Let's take a look at who gets a mandatory ticket to the NHI club.
The rules for who has to join are super specific. You're in if you're a citizen with a household registration, a brand new baby born here, or a foreign resident with an ARC who's been in Taiwan for over 6 months. But there's one big exception. If you're a foreigner here on a work permit, your coverage starts on day one. So let's imagine our friend Amy just got a job in Taipei. The very day she starts, her company is legally required to sign her up. No waiting.
Now, this next part is where things can get a little tricky for people, but I promise it's actually a really smart system. Basically, everyone is sorted into one of 6 groups, all based on what you do for a living. Take a look at this chart. It's basically the whole system. Most people, like Amy at her first office job, fall right into category 1. They enroll through their company, it's automatic. But let's say a few years later, Amy decides to become a freelance designer. Well, her situation changes, so her category does too. She'd then join a trade union and get insured under category 2. See? Everyone has a place.
And here is a super important rule. You don't get to choose your category. There's a clear order. If you have a regular job, you must be insured through your company in category 1. You can't be a full-time employee and then decide, I think I'll join a trade union's plan instead because it seems cheaper. Nope, doesn't work that way. Your main job locks you into your category.
So what about your family? Well, the system is designed to catch them in its safety net too. Family members who don't have a job, we're talking your spouse, your parents, or your kids under 20, they can all join your plan as dependents. So if our freelance designer Amy gets married and has a family, they're all covered right under her plan. It's a huge relief.
Okay, so we know who joins and where everyone fits. Now, let's talk money. How much do we actually have to chip into that giant piggy bank every month? For a typical employee, the cost is split 3 ways, and for you, it's a pretty good deal. You only pay 30% of the total cost. Your employer pays the biggest chunk, 60%, and the government pitches in the last 10%. So you're paying less than a third of the real cost. So that covers your monthly paycheck. But wait a minute, what about that huge year-end bonus you got? Or what about the money you make from that side hustle you've got going on? Does the NHI know about that? Oh, you bet it does. This is where something called the supplementary premium kicks in. The system takes a tiny 2.11% from other types of income. We're talking big bonuses, cash from part-time jobs, and even passive income like stock dividends or rent you collect. It's the system's way of making sure that all kinds of income help keep that piggy bank topped up. All right, we've talked a lot about what we put in. Now for the really good part. When you're sick and you tap that little card at the clinic, what do you actually get back for all your contributions? The amount of stuff that's covered is just massive. From a simple visit to the doctor, to getting prescriptions, to staying in the hospital, emergency care, even having a baby. It's all in there. But it's not a free-for-all. Things that aren't seen as medically essential, like cosmetic surgery, getting glasses, or hiring a private nurse, that's going to be on you. Now, even for the stuff that's covered, you usually pay a small fraction of the cost, which is called a copayment. And how much you pay actually depends on where you go for care. The system gently nudges you to go to a local clinic first for small problems. If you skip that and go straight to a huge medical center for a cold, well, your copayment is going to be higher. It's a clever way to save the big hospitals for the really sick people. But here is the absolute best part. For the really big, scary, and expensive stuff, that financial stress just goes away. Copayments are totally waived for things like cancer treatment, having a baby, and for people who live in remote areas. It's a huge safety net.
So, for this incredible system to work for everybody, it has to be protected. You can't have people taking advantage of it. So, there are really strict rules and financial safeguards to keep our giant piggy bank healthy. Remember that word compulsory? Well, it has teeth. If you try to game the system by not enrolling or lying about your income or making fake claims, there are serious fines. These rules aren't just for show. They're there to make sure the system is fair for everyone who relies on it.
But what happens in a true catastrophe, like another pandemic or a major earthquake? The system is ready for that too. By law, it has to maintain a safety reserve, basically a giant emergency fund with enough cash to cover the entire country's medical bills for at least 1 to 3 months. It's the ultimate insurance for our insurance.
You know, in the end, it all comes back to the very first line of the actual law. This whole complicated, amazing system we've just walked through, it exists for one simple reason: to enhance the health of all citizens.
And that leaves us with one final really important question. The NHI is incredible, but it's facing big challenges, like rising costs and a population that's getting older. So the big puzzle for all of us looking ahead is, how do we work together to keep this amazing health piggy bank full and strong for our kids and their kids?